Today I'll discuss about pharyngeal arches and their innervation. First, arch, then nerve, then muscle, then I'll discuss about the skeleton. First, pharyngeal arches, which is maxillary and mandibular process, which is trigeminal nerve. Trigeminal nerve, which is fifth nerve. Muscle is mastication, which is temporal, medial, lateral pterygoid. Second is mylohyoid. Then anterior belly of digastric. Then tensor tympani and tensor palatine. This is the muscle of first pharyngeal arches. Then skeleton. Skeleton is premaxilla, maxilla, malleus, mandible. If malleus is present, then incus. Mandible. If mandible is present, stylomandibular ligament. Then malleus ligament. Then zygomatic bone, part of temporal bone, and Meckel's cartilage. This is first pharyngeal arch. First pharyngeal arches, maxillary mandibular process, trigeminal nerve, muscle is muscle of mastication, mylohyoid, anterior belly of digastric, tensor tympani, tensor palatine. Skeleton is premaxilla, maxilla, malleus, incus, mandible, stylomandibular ligament, anterior malleus ligament, then zygomatic bone, part of temporal bone, and Meckel's cartilage. Then second pharyngeal arch, which is hyoid. Hyoid nerve is facial nerve, which is seven cranial nerve. Bone muscles is facial expression like orbicularis oculi, orbicularis oris. Then platysma, buccinator, auricularis. Then posterior belly of digastric. Anterior belly of digastric is first pharyngeal arches. Second pharyngeal arches is posterior belly of digastric. Then styloid, stapedius. Then skeleton is styloid, malleus incus there, and another is stapes, styloid ligament, and another is razor horn and upper portion of hyoid bone. Second pharyngeal arch is hyoid. Nerve is facial nerve. Facial expression which helps in facial muscle is which helps in facial expressions like orbicularis, oculiorbicularis, oris, platysma muscle, buccinator, auricularis. Then posterior belly of digastric, stylohyoid, and stapedius. In bones, styloid process, stapes, another in first pharyngeal arch, malleus and incus is present. Then second pharyngeal arch, one bone is left, that is stapes, styloid ligament, laser horn, and upper portion of hyoid bone. This is first and second pharyngeal arch. Now third and fourth. Now third pharyngeal arches, which is glossopharyngeal nerve, which is 9 nerve. Then muscle is stylopharyngeus, and skeleton is greater portion and lower part of hyoid bone. This is third pharyngeal arches, which is supplied by glossopharyngeal, which is 9 nerve of cranial nerve. Stylopharyngeus is the muscle of third pharyngeal arches, greater portion of lower part of hyoid bone. Now fourth pharyngeal arches, which is supplied by vagus nerve. Superior vagus nerve, superior laryngeal nerve, and recurrent laryngeal nerve. Muscle is thyroid muscle, like cricothyroid, and levator palatine. Another is constriction of pharynx and intrinsic muscle of larynx. Now skeleton is laryngeal thyroid cartilage, like arytenoid, cuneiform, corniculate, cricoid. Another is thyroid cartilage. Third pharyngeal arch is glossopharyngeal nerve, stylopharyngeus muscle, supplied by greater portion and lower part of hyoid bone. Fourth is vagus nerve, which is superior laryngeal nerve and recurrent laryngeal nerve. Muscle is thyroid, cricothyroid, levator palatine, constriction of pharynx. In thyroid, there is a cricothyroid, levator palatine, constriction of pharynx, and intrinsic muscle of larynx. Then in cartilage, this is arytenoid, cuneiform, corniculate, cuboid, and thyroid.